Hi, my name is Leslie, and today we're going to be performing an NG tube placement. So first things first, we always want to verify name, date of birth, and we always want to gather supplies and make sure we have a order from the MD to do this procedure. So we're going to measure the NG tube. So we're going to start from the nose over to the ear and down to the xiphoid process. And once you get to that point, you want to take tape and you want to measure. There we go. And then you want to wash hands and apply gloves. So while we're doing this procedure, it's important to know that we want the patient sitting up with their head back when we insert it. Once we hit the pharynx, we're going to have the patient chin to chest, and we're going to have them drink some water. So before we insert this tube, we're going to insert this in some lubricant, just the very end. And then at first, head sitting up, head back. So we're going to 1, 2, 3. Insert the tube. It's very important not to let go of the tube while you're inserting. At this point, we would set the patient up, chin to chest, have them drink water, verbalize it that, hey, are you okay? Any signs and symptoms of distress, we are going to stop at that point and remove the NG tube. If not, we're going to keep going till we hit the xiphoid process. Once we get to that point, we are then going to loosely secure. Okay, and then at this point we would verify the placement with either a chest x-ray or pH balance. So when we're checking the pH balance, we're just going to take the end of the tubing, pull up a little bit of the pH. Good. Put that in a container. Take a pH strip, dip, and then check the levels and make sure that they are normal. Once they are, once we verify placement, you then want to measure the outside again. I'm going to use tape here. Measure, mark that, and then we're going to secure the placement. Okay, and then at this point, you would either connect it to the tip of the end of it, or you would actually connect it to the suction, and that could be intermittent or continuous. You always want to make sure the tubing is above the head of the bed. Also, like I said, make sure when you're doing this procedure, you always want to make sure when you're inserting the tube to never let go of the tubing. That's very important. You would then remove gloves, do hand hygiene, and always make sure you document and assessing the NG tube, assessing to make sure the patient has no signs and symptoms of distress, and you always want to monitor the output of the NG tube.